The CDC Advisory Committee voting unanimously today to recommend COVID vaccine booster shots from Pfizer and Moderna for vulnerable Americans. The CDC, which has the final say, expected to approve later today. Joining us now, former FDA Commissioner Dr. Scott Gottlieb. He sits on the boards of Pfizer and Illumina, and his new book, Uncontrollable Spread, comes out next month. Dr. Gottlieb, great to see you as always. Thanks so much for joining us. I guess this was largely expected, and the question now is whether it's coming a bit too late to stem the Delta surge itself, and what your expectations are of when that might peak.
Well, the authorization was actually broader than I thought in terms of who they're authorizing it for. So the language specifies specific patients with certain immuno disorders, but then they have a broad classification for people who have chronic conditions that leave them immunocompromised, which scopes in a lot of patients. So I think they left a lot of latitude to physicians to make recommendations about which patients should be getting these shots. And they also left latitude to patients insofar as they're requiring self-attestation. So they're not trying to overcomplicate things, which I think is going to allow us to reach the maximum number of patients. Now, I do believe, and I've long believed, that we should be looking at providing boosters to the older population, particularly people in nursing homes or congregate settings who are more at risk of contracting COVID and more at risk of a bad outcome, people who were vaccinated a long time ago, last December or January, because we have seen evidence of declining vaccine effectiveness across the board in the Israeli data and other data sets that we've seen. In terms of when the virus is going to peak, there's an indication, it's a very clear indication across the South right now that you are seeing signs of the virus starting to peak. And what I mean by peaking is new daily cases will start going down probably this week. There'll probably be a discernible pattern towards cases day over day starting to trend downwards. That doesn't mean that the South is out of the woods, though, because you're going to continue to see hospitalizations build. And to the extent that healthcare systems there are pressed right now, they're going to continue to get pressed for several weeks, even as cases start to decline. What remains to be seen is what happens in the North and the Great Lakes region and the Pacific Northwest as Delta starts to spread across the country. Will we have an outbreak here? How dense will it be? I do think we're going to see infection pick up in the Northeast, for example. The question is, will higher vaccination rates and the higher amounts of prior infection, the immunity conferred by prior infection, will that be enough to provide a partial backstop against the kind of spread that we saw in the South? I certainly don't expect we'll see an epidemic on the order of what we've seen in the South, but we probably will see cases pick up here, perhaps significantly.
Why is this lasting longer, this surge, than it did in the UK? Simply because it's taking longer to spread across a much bigger country, or just different vaccination rates?
I think it's the former. I think that, in the U.S., what we've seen typically is regionalized epidemics. The only time we really had a confluent epidemic across the country was in the peak of the winter. Otherwise, this has been largely regionalized. There was an initial epidemic in the Northeast, then it spread to the South, then it spread to the Midwest. Right now, we're seeing an epidemic surge in the South. That's eventually going to spread north, particularly as kids go back to school, people go back to work, the colder weather starts to drive people indoors. What happens in the UK is largely driven by what happens in London. So it's really not an epidemic across the United Kingdom. It's an epidemic across the greater London area. Here in the U.S., you have regional epidemic surges. Right now, the South is experiencing that. That will eventually spread north.
Dr. Gottlieb, you mentioned the kids going back to school, and I think there are a lot of concerned parents, I'm one of them, about the children that are too young to be vaccinated with this Delta variant that seems to be hitting some children harder than we saw the original strain coming through. What's your best advice for parents? What do we know about this? How do we protect our children that cannot be vaccinated other than being vaccinated ourselves?
Right. I think it's unclear whether or not this virus is more pathogenic in kids. We haven't really seen evidence of that in the other countries where Delta has surged and created epidemics. We're obviously seeing a lot of kids hospitalized. I think there was something like 1,300 kids or 1,600 kids actually hospitalized just in the last week. But the question is that because this is more pathogenic in kids, it's causing more severe illness, or are we just infecting a whole lot of children? And I think it may be the case that we're just infecting a whole lot of children, and this epidemic is far wider than what we're measuring, that we're only really diagnosing 1 in 10 to 1 in 20 cases right now, and there's a lot more infection happening. So with the people being hospitalized are the tip of a very large iceberg. I think in terms of people going back to school, I think the prudent advice would be to try to implement as much mitigation and precautions as you can going into the school year, with the expectation that we really don't know how this is going to go this year. We don't know how virulent this is going to be, how widespread it's going to be in the schools. And so you need to go into the school year with as much measures as possible in terms of masking, distancing, trying to implement social podding, keeping kids in defined social pods, whatever we can do to try to control spread, and hope with the hope of keeping kids safe and also keeping the school year open.